Hey, how you doing? Well, I'm here today to be able to talk to you about some musculoskeletal products. These products are going to be mentioned on Dr. Robert Silverman's seminar, actually webinar, which is going to be offered to all of your doctors out there. It's going to be focused towards chiropractors, which, by the way, are 3/4 of the clients that we have currently. So it's important to be able to make sure that we can service them on things that they see every single day. Musculoskeletal injury, spasm, and pain is really what we're going to be focusing on. But not just that acute phase, the phase of repair that happens afterwards. Unfortunately, many of the patients out there will oftentimes will leave treatment when they're out of pain. And this program, which is known as 3 Phases of Care, which is a really excellent program for not only instructing the practitioner how to be able to help the patients with chiropractic, but also how to be able to utilize nutrition there as well. So basically speaking, what we have here is we have a number of different products which can be very, very helpful in these 3 phases of care. The first phase is the acute phase, and that happens between 3 and 5 days after the actual injury itself. And that acute phase usually has different factors: pain, muscle spasm, and swelling. And we're going to talk about 3 different formulas which can help that. So you'll understand when the doctor gives you a call and says, what are they talking about on the webinar? What are these formulas? You'll be able to give them answers and make quick and easy sales with them on disorders that they see on a daily basis. So the first thing we're going to talk about is pain. For that category, we're going to be talking about a supplement which we're going to call the reduced iso-alpha acid supplement. We're not going to be using the real names here for legal purposes. And our reduced iso-alpha acid supplement contains not only the actual TIAA, which is the tetra version of reduced iso-alpha acids, much more potent than the older version, but in addition to that, it also contains rosemary, and it also contains olive leaf extract or olenolic acid. All 3 of these items have actually been studied through a process which is known as our expressin process. And that is where we actually take these substances and see how they affect the inflammation within human cells through what's known as proteomics research. We are one of only 4 different proteomics research centers in the country. So that's pretty impressive in and of itself. And it really allows us to be able to make sure that we get results on our products and we study our products before they go out to the patients. In most cases with other supplement companies, they put together formulas, hope that they're synergistic, and the real study happens when the doctor hands it to the patients and the patients become the guinea pigs. That's not what happens at Metagenics. And we did this through our express type of approach of formulating. So it contains these specific herbal extracts in there for the following reasons. They have been shown to do the following. They've been shown to reduce prostaglandin E2 very aggressively, as well as such things as the COX-2 inhibitors out there, one of which was taken off the marketplace due to side effects, that being Vioxx, and not have any of the side effects which have been shown to be problems in not only COX-2, but NSAIDs or non-steroidal anti-inflammatories like naproxen sodium or Aleve. So basically speaking, this reduced iso-alpha acid formula has the upside of that, but none of the downsides to cardiovascular risk, none of the downsides to gastrointestinal, kidney, or liver risks as well. So that's an important factor, and that is our reduced iso-alpha acid formula, and you can contact your manager to find out the name of that and the dosage. The next thing that I'd like to talk about is our formula that deals with muscle spasms. Let me turn to that page. Okay. Our muscle spasm formula contains a couple of different nutrients. The first one is calcium, and the second one is magnesium. Both of these are essential for proper muscle relaxation and contraction. So calcium and magnesium important. Next ingredient in there is known as passiflora or passion flower, and both passiflora and valerian root extract work on the nervous system. This combination of calcium, magnesium, passiflora, and valerian root can be very helpful as a natural muscle relaxant. Many of the muscle relaxants currently in the marketplace do have possible side effects. This does not tend to have side effects in the same way, so it's a natural approach. For dosage for the muscle relaxation formula, contact your manager. And the last one here is our lymphatic drainage formula. Contact your manager for the true name of it. And it contains 2 different types of enzymes, trypsin and chymotrypsin. These are both protease enzymes to break down proteins. Now, why would we want that? To reduce inflammation and swelling. Well, when you get into a form of accident, whether it be through micro injuries, lots of different times when you stress the back, adding up to a final result of a back going out or something like that, or a true accident itself, what actually happens is you form trauma to blood vessels as well. And these blood vessels, when they're traumatized, will oftentimes release the proteins in the blood, one of which is known as albumin. When the proteins actually reach that space in between muscle cells, or in between cells known as interstitial fluid or the interstitial space, basically what happens is those proteins get attacked by the immune system, forming an inflammatory response, because those proteins should be staying inside blood cells, not getting into that space in between cells known as interstitial fluid or interstitial space. When they have the inflammation, it forms more water going into that area, and in addition, that forms inflammation. So this can be a problem, oftentimes seen as swelling, and even many times not seen as swelling, but found usually when you have yourself some sort of low back or back injury. So when you have this situation, you have all these proteins and all this fluid in the interstitial space. You need to break down the proteins so they're able to release the fluids and the proteins into your systemic circulation of your bloodstream so they can be gotten out of the body. The one thing that gets in the way is the proteins many times are large, and they can't get through what's known as regional lymphatic drainage sites. So the proteins need to be broken down. It's sort of like trying to be able to get a watermelon through the drain at the bottom of a bathtub. It's sort of hard, it's sort of large. So you need a blender to be able to blend it up and turn it into watermelon juice so it can get through. Well, those proteases break down the proteins so that can happen, and also all the water in the bathtub gets through, or the extra water which had been seen through the injury gets through as well, cutting down on the inflammation and cutting down on the swelling. This can be done with those specific amino acids found in the lymphatic drainage formula, and they are specifically chymotrypsin, trypsin, and also bromelain as well. So all of these different types of protein-breaking enzymes really cut down on the swelling. For dosages and when to be able to take them, contact your manager. These are the three formulas: the lymphatic drainage formula, the muscle spasm formula, and the pain formula. Please ask your local regional manager about them, and those formulas are going to be mentioned during Dr. Robert Silverman's webinar on the 3 phases of care. Simple ways to treat your patients for chiropractic issues with nutrition and to overcome losses to managed care. Thanks so much, and we'll speak to you soon.